Hello and welcome to Health Matters. I'm naturopathic doctoral candidate and registered holistic nutritionist Eric Robinson, and I will be your host this week. On tonight's show, the topic is how to achieve your ideal summer body. We've got some great guests on the show tonight, including personal trainer Colin Cummins, Moksha Yoga instructor Edward Apostle, and two experts from the McLean Clinic of Cosmetic Surgery, Miriam Denham, to talk about skin things we can do for our skin in the summer, as well as Dr. Corey Goldberg to talk about plastic surgery options. With me first on the show is Colin Cummins. Colin's a personal trainer and kinesiologist, and he's director of the Red Eye Pro Baseball facility. So Colin provides one-on-one and group personal training options, and he's going to talk to us about fitness for the whole family. So Colin, welcome to the show.
Thank you for having me.
So Colin, I think the first thing that I want to ask you is, you've been known in the Mississauga area for doing a lot of group and one-on-one fitness things. What do you find are the most pertinent issues that people have in the summer? What are their main goals for the summer?
A lot of them, a lot of it's trying to find the time to just actually do a lot of things within the group settings. So once they do get into the group settings and they're around each other, they're able to do more along with being a little bit more charismatic, being able to just do more training possible. And that's just the biggest thing, is that they're able to get around and do more when they're within their group.
So you find that being in a group dynamic, does that tend to make people stay with their fitness goals more or pursue fitness for a longer period of time with the partnership of other people?
It seems like it, because it seems the biggest thing is that they're always around their friends. So it's almost like that gentle push. They're getting their chance to do more with that person. It's more camaraderie. It's giving them more fun. And it just gives them a chance. It gives them that little upbeat feeling that they feel better amongst their friends, and they're seeing goals coming about.
And I bet that's a good thing for summer too, because not only are you spending time with your friends, but you're also getting in shape, right?
Exactly.
Nice. Do you find that you tend to take your clients outdoors more in the summertime to enjoy the fresh air?
Most definitely. We can do a lot more outdoors. We can also get them a chance to go use some hills. We get them a chance to use some downhill obstacles, or even just using like a general playground could be a complete obstacle course, giving people a chance to just utilize their own body weight, which is a key fact, because lifting weights are usually pretty good, but sometimes become a detriment because of some person's strength. So by building strength of their own body weight, it gives them a chance to do more.
Oh, that's great. And what do you find people are specifically looking for? Is fat loss one of the big goals? Because I know summer is one of those times of year when we tend to show more skin.
Most definitely. I think that especially around the core area, which is like the new key phrase for everybody having to do with their core, a lot more people want to be stronger, right? So their core has to be pretty strong, keeping their back sturdy. It's, the amount of work, lifting, bending, and everything, like making sure that their core is always strong is a key thing that they need to do.
And probably not just for looking good, but also for feeling good and preventing lower back pain in the future, right?
Exactly.
Excellent. So let's just deviate for a second from the adult side of things. You do fitness for kids, including after-school programs. Is that right?
That's right.
So where are you currently offering the after-school programs?
I do. I'm actually at a couple of public schools in the Mississauga area. I'm at a public school in the Leaside area, which is within Toronto. But basically, I'm at 3 schools, and I'm running programs, and it's amazing. Like, basically, it seems like it's 1,000 kids, because it's just everybody screaming, having a lot of fun, and running around. But they're getting the most exercise as we can for the time being, for about an hour, until their parents actually pick them up.
So I mean, this is convenient for a number of reasons, because not only are you keeping the kids occupied after school before their parents get there, but you're also helping them keep fit. And in the face of an obesity epidemic among children, this is probably a great thing.
It is, especially when after school, if they're kind of like not to say that there's anything wrong with being in a daycare, but just being able to give them an option that allows their sons or their daughters to be able to do more. And if it's, kind of like a guided schedule that gives them a chance to, just run around, but not miscellaneously, but be around something that's structured. It's tremendous.
So, in looking at preventing obesity or even dealing with it amongst children, do you recommend any certain activities for kids to enjoy?
I think if they're able to just get into something that'll allow them to burn off the amount of energy that they do have, especially from the day of kind of being in a seated area, like 15 minutes to go out on recess. that's great. 15 minutes again at lunch, or an hour at lunch and then 15 minutes again. But have that last little bit of that last hour of just being able to get out and do more, which really helps. It really helps out a lot of kids.
So recently, I'm not sure if you heard in the news that Health Canada has trimmed back the guidelines for physical activity for kids. So I think it used to be an hour that they recommended, and now it's about 30 minutes. What are your thoughts on that?
I think they need to build it back up. It's really tough. It's really tough to just, they have so much energy and they need to burn it off. And if it just stops at a certain time frame, then like what happens to them? And we really need now they have a snack time. They're allowed a snack time, but I think they need that physical activity, because if you talk to most parents, their sons or daughters are at home and they're on Xbox, they're on this, they're on that. We need to give them a little bit more outside time so that they can get out and do more.
That definitely sounds like a good plan. And now that summer's around the corner and the warmer weather's coming, what kinds of activities would you recommend to, say, parents to do with their children during the summer?
If you can get out and walk, a lot of kids like to go on a stroll, get on their bikes. They like to get on their scooters. If they get on a skateboard, all that type of exercise that they're able to do with all those instruments are perfect. Even if they can just go on, like, a long stroll is great, and you start to see a lot more parents getting out there in a family event, and they're just having fun. It's awesome.
And what about for yourself and your own kids? How do you make sure that they stay active?
They're on their own.
Yeah.
No, basically, we get out and we go for a walk. We do a lot of things that will allow them to have fun in a group setting, so our group setting, and being able to just go out and talk to their friends as we go on strolls and whatnot. That brings a lot of light to us.
That's excellent. And so we're keeping the kids busy, but what kinds of activities can parents be engaging in? Say if they're the busy ones over the summer, dropping their kids off at the sporting events. What do you recommend to them to stay in shape?
There's so many little things that parents can actually do if they just take the time, like, even if it's 20 minutes just to go out and it's once again, it's going out on a little bit of a stroll, going on a little bit of a walk. Yeah, we're busy, but we're not that busy that we can't look at ourselves to make sure that we're taking care of ourselves as well. It's just really small things that we need to do for ourselves to get out there. So once again, a stroll, a little bit of a walk, run, something that's just a little bit different. Find a stairwell that we just need to climb.
That's great.
Right?
So using what you have around you, essentially.
Exactly.
And I think, too, a lot of people think we need all this fancy equipment to stay in shape or to get in shape, but really you can use, like you were saying, monkey bars or a park or the local setting, hills even.
Anything. I mean, even if you'd be surprised that even if you went on a swing, just that fun that we used to have, there's an exercise for you as well.
And it's calorie burning too.
Exactly. So, like, I mean, even go follow your son, follow your daughter up a slide, up the little jungle gyms that they have out there now. It works out the best for everybody.
So it's definitely caloric burning, and you're having fun with your kids at the same time.
Exactly.
Excellent. So let's talk a little bit more about what you offer for kids, because you are the director of Red Eye Pro Baseball. So actually, first tell us, how did you get into baseball?
Baseball was one of my first loves. So basically, just growing up and finding out that we had a baseball team in the city, and Toronto Blue Jays. It was the Toronto Blue Jays all over the place. So I mean, it was just one of my first loves, and I started to study it a little bit more, got into it, went ahead and started playing more, and then luckily I had opportunities, and I took an opportunity, went down, played for Team Canada. I got an opportunity to play in the States, both at the collegiate level and then also professionally, and it's just my chance now to give back for all the stuff that I've learned, and I'm giving back now. It's a lot of fun.
And so you did actually attend Seton Hall University for a sports medicine degree on a baseball scholarship, is that right?
That's correct.
Wow, so you do have the experience both in coaching and in playing yourself.
Yes, I do.
So what kinds of results should parents expect if they are signing their kids up for a baseball camp over the summer?
I think that the biggest benefit is that if they're coming out, like, by the time the 5 days are over, your son or your daughter is gonna learn a ton of things. But if they leave there with just one thing that they thought was the best thing for them, that's the biggest thing for me, because I know that at least that's the one thing that they really counted on. They're going to get a chance They're going to know the ins and outs on how to stretch, how to get themselves ready and geared for a game. They're going to know how to set themselves up for when they're going up to bat. They're going to know how to pitch, run, throw, catch, giving them all types of opportunities to do whatever's necessary, but whatever they can do that can take them into their next step, which is into their games during the summer as well.
So definitely improving their skills behind the scenes.
Exactly.
That's great. And what kinds of programs do you offer at your facility?
There's a variety of programs. I run anything from, there's membership bases, there's hitting programs, catching programs, pitching programs. There's team programs as well. So like if there's a rain out, come on over, we'll give them an opportunity to definitely train within the facility. If they want to train with an instructor, they can train with an instructor. If they want to train by themselves, they can definitely do that as well.
So you've got both one-on-one and group options then?
That's correct.
Great. And what kinds of ages do you tend to see coming through the camp?
Right now, I'm seeing anywhere from 10 to 15. And that's the actual age range that you start to see the big transitions. As they get a little bit older, now they're starting to move into categories where there's more live pitching, and then they're getting into the actual Major League Baseball depths and dimensions. So it makes a big difference. This year, Baseball Canada went ahead and said that the minor bantams have to swing wood bats, and it's a big turnover. It really is. So it's going to give guys a chance to really see if they can really hit or if they can't hit.
So Colin, what would you say is your overall goal then for the facility that you've created? What's the vision that you have in mind?
I just want to be able to train and give players a full opportunity to just train and be the best players possible.
Definitely. And any final words before we head out?
None too much, but it's just basically let's just have a real fun summer and get a chance to train and be as healthy as possible.
Great. So that's excellent, Colin. Thanks so much for coming on the show. You shared with us a little bit about not only how to keep the kids fit, but also how the adults can get fit as well. And you've got a lot of options, so people can definitely log on to your website and check you out, basically, right?
That's right.
Great. Thanks for coming on. We'll be back with Edward Apostle. listeners with our next guest. We're talking today about how to achieve your ideal summer body. What better way than yoga? We've got Moksha Yoga instructor Edward Apostle here to share with us the benefits of yoga and how we can use it during the summer to achieve better health. Hi Edward, thanks for coming on the show.
Thank you very much.
So Edward, I have personally seen the benefits of yoga in the rehab setting when I worked as a kinesiologist, and I know firsthand that yoga is so good for achieving better balance, better strength, and better proprioception, and healing from an accident. So maybe you can share with us some of the benefits of yoga and how we can use it in the summertime to achieve better health.
Well, yoga has recently become very popular in Toronto and Canada and in Peel, and for yoga enthusiasts, we find that there's a definite mind-body connection, and once we are in tune with our bodies, we find that our stretches and the postures that we perform are actually enhanced and allow ourselves to actually lose a lot of weight. When I first experienced yoga myself and I started to practice on a daily basis, by the end of a 3-month period, I had lost over 30 pounds.
Wow, that's
and
phenomenal.
If you're preparing for a summer body, that's kind of a good way to start.
What better way?
What better way to start than practicing yoga?
Well, that's excellent. And that was definitely one of my questions for you is, do you find people that come to your yoga classes, do they tend to lose weight?
Of course, of course. Now, the amount of weight that a participant or a practitioner loses will vary depending on how much they practice, depending on their existing diet. But for a lot of people who practice Moksha Yoga, we find that there's a general slimming of the body, a lengthening and improvement of the posture. And even if they lose as little as like 1 or 2 pounds, they feel a lot better for it and they become more active as a result.
That's excellent.
Yep.
Maybe we can backtrack a bit too, because you touched on how yoga is becoming more popular. And definitely I know in the Peel region, we've seen so many studios open up in the last few years.
Right.
So what do you think brought on this surge in popularity for yoga?
Well, I think it was in the introduction of a lot of people from India and other countries who practice yoga, and just the multicultural mix that we have in this city introduced the culture of yoga. And as a result of that, a lot of studios started to pop up and people got curious about yoga as an alternative way of being fit. Okay, not only, first of all, on a physical level, because there are physical benefits to it, but also on a mental and sometimes on a spiritual level for some people as well. And as people got more informed about how yoga can benefit themselves, people started to come into the studio more and more often. And I, for one, welcome a lot of people from different practices, not only in a hot studio, but in a non-heated studio as well. And we all welcome the forms of yoga that are found in the city.
Wow. So you touched on the mind, body, and possibly even the spiritual aspect of it. When people are signing up for yoga, do you find that they tend to come for the physical activity component, for the mental component, or is it both, or do they start with one and go to the other? I
think in my personal experience, a lot of people are initially introduced to yoga for the physical aspects, right? In the yoga series that we practice, it's a series of postures, and it involves strengthening the muscles. It also involves working on the heart. There's a good cardiovascular component to it as well. But as they venture forth and journey on a path of yoga, they find that it also relieves a lot of mental stress, because it gives people time to think and reflect on what happens during the day as they sit there in their postures like this.
Yes, it's
and
true.
Then they may find some resolutions to some of the issues that they're encountering on a day in, day out basis. So not only is there a physical component, but yes, there is a good mental sense of relief, and the people coming out will feel like, afterward, they just feel so incredibly relieved.
What a great way to feel after you've been getting exercise too. And I think dealing with stress is something that in the region of Peel we really need to tackle, because so many of us are overworked and underslept and very stressed out. And I have to say too that being stressed in itself contributes to weight gain. So I think from that aspect, yoga is probably very helpful in cutting the stress back.
Oh, I agree. I myself not only am a practitioner of yoga, and I teach yoga as well, but I'm also involved in the office environment. I'm involved in information technology. It's a very stressful workplace.
So you know, yeah.
And so I know about deadlines, and I know about dealing with all the high, fast pace of business. So having this contrasting environment for me is a very comforting, almost a blanket-like state of mind and a state of body. And I find that many people come in, right after work in order to find that sense of relief, to find that sense of balance in their life, to relieve themselves from the stresses that they might encounter from their workplace.
Well, I just love that you have the personal experience of it too, so you know firsthand that it works.
Oh, I know, and that's what really drew me to it. I mean, I just literally dropped into a studio one day, and I was stressed out, just like many other work folks, and I took my first class, and from that day forth, I never turned back. I just kept on going one day after another, and I slowly felt the improvements over time, and it also enhanced my other activities, not only, like I said, in workplace, I come with a clear sense of mind in the office, but in other athletic activities I do. Like I like snowboarding, I like canoeing, I like camping, and all those things I now come in with a renewed sense of inspiration, a sense of strength. I'm able to tackle these things, where before I wasn't able to tackle them as easily, and now I can do it. I can just say, hey, this is great. I'm calm. Not a problem. I just push this block along and keep on going.
That's excellent.
Yeah.
So tell me then, Edward, is moksha yoga or is any kind of yoga a complete workout?
Oh, definitely. As I mentioned before, it is a cardiovascular workout. So it works on the heart. It gets your fluids going. It's also a good strengthening workout. As you sit, as I keep on going with my arms raised in this particular posture for an extended period of time, there's a lengthening of the muscles. There's strength and endurance that's involved. And as I said, and I keep on stressing again, there's a good mental component to it as well. Mm-hmm. So it's a very encompassing workout in terms of physical, in terms of the mental nature of it. And then, as I said, for some people, there's even a spiritual component to it as well. They have a sense of relief. They find a sense of inner peace.
Wow. And so you're currently located at the Moksha Yoga Studio in Mississauga, right?
That's right. That's right.
So can you tell us what the difference is between Moksha Yoga versus regular yoga?
Well, first of all, Moksha Yoga is a series of postures, and we offer the class in a heated environment. So we start off at an average of about 37 degrees Celsius. Okay.
Pretty warm.
So that's the primary difference. We also have, in the Moksha Yoga world, we introduce a sense of community. So we involve ourselves in charities, and we also have people who come into the studio. They're always welcome to stay in the studio and to talk to other people and recall and recollect their practices. We also get involved on an environmental level. We're an environmental conscious studio. So everything from the heating systems, the electricity, the water that's supplied is all environmental friendly or meets some sort of environmental requirements.
I love that.
So that's one thing that differentiates us from a lot of the other studios.
So you can feel good about supporting a studio like Moksha.
Exactly. We have a very low carbon footprint, and like I said, the sense of community that is offered in the Moksha studio is really, really inspiring. We're actually doing a 7-week program right now called Living Your Moksha, and there are 7 pillars that Moksha represents, and these pillars include community, we call Sangha. We also have being green. We also promote healthy living, healthy eating of good food, and we have discussions about that. And then the number of other pillars, regular practice, that goes on through a 7-week period.
Wow, so it's not just about yoga in the studio, it's about a whole lifestyle approach then.
Exactly. It extends beyond the mat, the universe of the 6-foot by 3-foot mat that we call it sometimes. So when we extend it to the outside world, we live yoga every day. And I mean, in fact, one of the things that I'm working on as a kind of a project is to kind of illustrate how yoga can be incorporated in our life every day. We can see it in different places. Just sitting at a desk, just breathing, for example, that's yoga, right? Wow. So from that to eating your meals and participating in dialogue with other people, that's also living your yoga or living your moksha.
Well, that's great. I love it. So what I want to know too is, for people who've never practiced yoga, how will they know if Moksha Yoga is appropriate for them?
Moksha is a very welcoming environment for everyone who's a beginner to someone who might have practiced for many, many years, right? The series of postures is laid out in a very friendly manner. The instructors guide the students in an appropriate manner, providing adjustments when necessary to make sure that they're comfortable, being aware of the person or individual's body and their needs. So nothing ever gets too difficult, right? So whether you're a beginner or an advanced person, the Moksha series of postures is very welcoming to everybody.
Well, I love that. So it seems very tailored to the individual almost. It's a group setting, but yet people will correct you and you don't have to go all the way if you're not ready for it yet.
Exactly, exactly. It's in some other practices, it seems to be very regimented, but our practice is a very relaxed environment. We encourage people to go as far as they need to go, right? And if they can't reach their arm this far today, that's fine. Maybe they'll reach it up tomorrow, right?
Great.
Yeah.
Well, and what should we be bringing to our hot yoga class?
Well, generally we recommend wearing loose clothing, loose, comfortable clothing. It is a heated environment, so you're going to be guaranteed that you're going to sweat just a little bit. So in condition of that, you'll bring a water bottle filled with water. You'll bring a mat. Most studios offer mats for rental as well, and a nice long towel. You'll see here I'm wearing clothes, these nice shorts and this breathable shirt. I wear a bandana, but that's just my thing personally. But any breathable clothes that allow you to sweat cleanly through your body, you can bring to the studio.
So anything that'll allow you to sweat and not, get
not
constrict
too overheated. Yourself. Yeah, bring a second set of clothes to you afterward because, yeah, as I said before, you will sweat. So a mat, breathable clothes, towel, and a bottle of water are minimally what you need.
Okay, and I think I have one more question for you, and it is, since we're seeing mostly females in the yoga side of things, maybe you can briefly in the next 30 seconds just tell us how can we as women convince our male partners or friends to join us?
Yes, yoga was actually traditionally a male discipline. It was traditionally a male-oriented practice. And in the studios that I practice in, we get a lot of NHL hockey players.
Great.
We get a lot of CFL football players. And most recently, we've had a number of mixed martial arts participants. Because, in the traditional male-dominated realm of sport, we're focusing on being big.
Great.
But we focus on the flexibility as well. And that's
I
what
love
welcomes
it.
us.
So yoga is great for men. Thanks so much for coming on the show, Edward. And you can refer to Ed's website and information for any more info.
Thank you.
Thanks so much.
You're
That was
welcome.
great. Hello and welcome back to Health Matters. We're discussing getting your ideal summer body. We know that the proper nutritional plan and exercise can only get us so far with certain goals. So we've got two experts on now from the McLean Clinic. First, we'll be joined by medical skincare specialist Miriam Denham to share with us her knowledge. So welcome to the show, Miriam.
Thank you.
Thanks so much for coming on. So I want to know, first off, what kinds of services do you offer or can you tell us about at the McLean Clinic?
We offer a lot of services that help to rejuvenate the skin, from Botox and Juvederm to lasers such as the photorejuvenation, laser resurfacing for acne scarring, microdermabrasions, chemical peels, medical grade skincare.
Wow, that sounds like quite a lot that people can take advantage of at the McLean Clinic.
Yes.
Great. And now that it's coming into spring and summer, what services do you find your clients tend to be most attracted towards at this time of year?
A lot of people at McLean Clinic want their skin to be fresh, revitalized, and bright for the summertime. So we do a lot of microdermabrasion and chemical peels because they offer very quick results without any downtime. And it just buffs off the outer layer of dead cells.
Wow. So that was my other question too. How long can people expect to be out of work or out of being able to do their activities when they do these kinds of treatments?
Well, it really depends on the specific type of treatment. More for acne scarring, there's a little bit more downtime because those are ablative treatments, which means it disturbs the natural process of the skin. But medical grade skincare products, microdermabrasion, Botox and fillers, very little downtime.
Look at this too. So you can tell us a little bit about Botox then, is that right?
Yes, Botox is one of the #1 non-surgical procedures done worldwide. And probably at McLean Clinic, it is our #1 procedure.
Really?
Yes, it is a natural protein. It is injected into the wrinkles on the face, and typically we use it on the crow's feet, the frown lines, and in the forehead. It's a very safe drug, very simple to perform, no downtime, and very quick.
Wow, so that sounds like a pretty good combination. And how long do the results typically last with Botox?
Typically 3 to 4 months, and we usually use a combination approach. So we'll do Botox a lot of times with a product called Juvederm. That is a hyaluronic acid, and it's a natural sugar found in the body. And if you look at Janet, one of our patients, this is her before starting the treatments, this is her right after the treatment, and this is her 1 year after, with just a mild tune-up of Botox.
Wow, and that's just an incredible difference to see. All of the major wrinkles are gone on her face.
Right, with minimal downtime.
Wow. And from that point on, do they have to come once a year, or how frequently would you recommend?
There would be a little bit of maintenance, only one treatment in 1 year with the touch-up of the Botox. So for Janet, she got great results. You know, it really lasted for her for a long time.
And I think another topic I want to touch on, because it is summer and we're starting to bare more skin, is the laser hair removal. And that's something that is offered at the McLean Clinic as well, is that right?
Right, we do a lot of laser hair removal. Typically, the summertime, we've already started a few of the treatments. So by the summer, we'd like our patients not to have a tan because tans are contraindicated for laser hair removal. But it's very successful. Our patients are very happy with it.
And what areas are people tending to treat the most for laser hair removal?
Usually the facial region on the upper lip. We do the underarms, typically the bikini line, legs, anywhere on the body that hair is a problem for our patients.
So you can do anywhere then?
You can do anywhere on the body, yes.
Great. And basically, how many treatments are people looking at with the laser hair removal?
They usually range from 6 to 8. And it's a 70 to 90% permanent reduction. There's no 100% reduction because the body is a living, breathing organ, and different times in your life you stimulate hair growth.
That's true, but still 90% is huge.
Yes, yeah.
Wow. And then what can people expect in terms of, is there any pain with the laser hair removal?
There's a little bit of discomfort, but our patients are very happy, and usually the outcome oversides the side effect.
So they definitely find that it's worth it.
Yes, because laser hair removal really, it's easier on the skin long term because shaving and waxing really irritates, causes ingrown hairs. So it's just a very popular service.
So then people can be looking at no longer having to shave so frequently, I guess,
Right.
in the future, right?
Absolutely.
Wow. And then what I what I want to know as well is this predominantly women that you're seeing, or do you find there's a growing number of men that are becoming interested in the services that the McLean Clinic offers?
Growing number of men. Men are interested in Botox, Juvederm, medical grade skincare, laser resurfacing, photorejuvenation, everything.
Just about everything.
Just about everything.
Yeah, I think men are seeing the importance too of looking and feeling their best just as much as women are.
Right.
And what other treatments do you find are very popular that you tend to administer this time of year?
Well, our number one defense against aging is sun protection. It's always important to have sun protection with an SPF of about 45 and above. We'd like to have our sun protections to include zinc and titanium. They're natural elements.
Okay.
They don't cause sensitivities on the skin, and they cover the UVA and the UVB.
Right, we want both of those to be
absolutely
dealt with.
A good partner for the sun protection is your vitamin C. It's an antioxidant. It's a natural substance. It's applied to the skin in the daytime. Our body doesn't produce it, so we need to place it on our skin to sort of mop up all the damage that's caused from UVA and UVB.
Right, because this will deal with any free radicals, right?
Absolutely.
And I'm guessing for issues like if you smoke or if you're subject to pollution, this would also be very helpful.
Absolutely.
And what makes you say to go with the SPF of 45 as opposed to 15, say?
Well, 15 really doesn't give you enough protection. You need to add on throughout the day even to really keep the SPF at the maximum. So always look for the zinc, always look for the titanium, because it gives you, rather than a screen, it gives you a block to the skin.
Right, because the other sunscreens are more like a chemical sunscreen,
right,
is that right?
And the chemicals over time will degrade the natural complexion. It dulls the complexion.
So going for more of a natural, kind of a mineral base almost with the zinc
Absolutely.
oxide. And I find that a lot of people aren't aware too of putting on the sunscreen just for everyday activities like driving in the car, and then they'll tend to develop sunspots or age spots.
Yeah,
so
we notice it on the left side more. When people are driving, the reflection through the glass window. Always a lot of pigmentation or hyperpigmentation on the left side.
So it is definitely a common trend then?
Very common trend, yes.
And how can we deal with those spots once we've acquired them?
Depending on your skin type, we have medical grade products, or we have different types of light-based treatments, the photorejuvenation. For skin types that have a little bit more pigment to them, it's safer to use medical grade products. And the difference between medical grade products and over-the-counter is that the concentration of active ingredients is much higher. It needs to be supervised, it needs to be distributed through a physician, and you need to have follow-ups. So this helps to diminish the brown spots on the skin.
So this would be something that people could only get once they see a doctor who's specializing in this?
Yes, yeah, it starts with a consultation with a medical skincare specialist. We address the expectations of the patient. Then we also develop a plan that works for both of us.
Perfect. So, and tell us exactly what are these products doing and what is this? Is this a whole line that we're looking at?
Yeah, this is a system. It's called the Obagi system, medical grade. It's a transformation system. So for people that are experiencing those brown spots on the skin, dullness, sort of a diseased skin almost, we have hydroquinone, which is in our step 4 and step 5. A little bit of glycolic acid, which helps to dissolve the outer layer.
Okay.
It's a real system that we coach our patients through.
And how do you find the results tend to be with this?
With the Obagi system, our results are fantastic. Patients at McLean Clinic are very happy.
And I guess it's nice because they can take it home, they can do it at home. It's not a huge time investment.
Right, right.
And how often do you find that they have to get just one kit or several?
When we have our consultation with the patient, we really assess what their needs are, their expectations. Usually a kit this size would last about 6 months. But with the medical grade, we constantly follow up with our patients. It's very important to develop a relationship with your patient. But a lot of times it's a combination therapy. Sometimes the medical grade, sometimes the lasers. So at McLean Clinic, we offer all of the above.
That's excellent. And I love that you're looking at developing those relationships with patients because I'm sure it offers better compliance to the program and gets better results, right?
Right, right, right.
So you're not just seeing them and sending them out into the wild, you're coaching them through it.
Absolutely. It's very important to have that. We foster relationships with our nurse injectors who do the Botox and the Juvederm, and with our surgery because we offer full surgery at McLean Clinic, as well as the skincare. It's a real mesh.
And the McLean Clinic is located here in Mississauga, right?
It's in Mississauga, close to Square One.
It's very convenient.
Yes, yep.
And as you're mentioning, it would be a nurse that would be administering the Botox?
The Botox and Juvederm are injected by nurses or physicians. That's a very standard that patients should look for.
Okay, so definitely a higher level of safety when you're going with a professional to do the job.
Absolutely. You should always make sure that the physician is on site. And we at McLean Clinic always practice safety.
That's excellent. And I want to know a little bit more about the consultation. So say I'm interested in having something done. What does the consultation involve? What does it look like?
The consultation is a free consultation. We come in, I give an introduction to myself, what I offer at the clinic, and then I always open it up. What do you want to see change with your skin? So I listen to the patient and try to address their expectations.
And I've definitely heard people who are very satisfied with the results. I know some people personally, so McLean Clinic does deliver, it seems.
Absolutely. We're very happy.
Yeah, and you find the patients are often very happy with the results.
They're very happy. We develop long-lasting relationships that feed patients through injections, through skincare, and through surgery. And a lot of these patients, it's almost generational. And we are very happy to foster that.
Yeah. That's excellent. And now, do you, Miriam, have any other tips that you recommend to the people that you see, whether it's dietary for skin health or anything else that you recommend to do aside from the treatments?
Well, I think diet is important. We really specialize as a patient in a whole, but we don't specifically deal with the diet. Skincare and treatments such as the ProFractional as well, which is laser resurfacing. We like to just offer everything that the patient needs.
Maybe you can briefly touch on to ProFraction and what that involves.
Right, we're very excited to have that technology at the clinic. In the past, acne scarring has been very difficult to treat. So that we find now with a few treatments spaced about 3 weeks apart, patients see a huge decrease in their acne scarring.
Really? That's something that I'd definitely be interested in because there currently aren't very many good ways to deal with scarring. Even if you've recovered past that sort of teenage stage, or even now we're seeing older women get acne. Once they recover from that, there's still the aftermath.
Right. The acne scarring is quite a dilemma for people. And you're right, it's different ages from the young to the professional. So we like to be able to offer treatments that have minimal downtime. So our patients within 3 days are really back to functioning.
Wow, and about 3 sessions you were saying?
It depends on the severity of the acne scar. So in that consultation, we'll assess that.
That's excellent. Well, thank you so much for sharing your expertise with us today, Miriam.
My pleasure.
That was great. When we come back, we'll be joined by Dr. Corey Goldberg, also from the McLean Clinic. welcome back to Health Matters. Today we're talking about how to get our ideal summer body. So as we mentioned in the last segment, it's not just about diet and exercise. There's some changes that we can achieve through those methods. Joining us next is cosmetic surgeon Dr. Corey Goldberg. So welcome to the show, Dr. Goldberg.
Thank you very much. Nice
Thanks
to be here.
Thanks so much for coming on. I'm really interested to hear what you have to say, and I think what we'll start off with is, what treatments do you typically see patients coming into the McLean Clinic for more often this time of year?
Well, I think spring and summer tends to be the time of year that people think most about their breast and their body.
Yeah.
It's bathing suit season and everybody wants to be tuned up so they can go out and show off.
That's right. So those are the most popular things. And who do you find is the typical patient as well this time of year?
Well, it's an interesting thing. A lot of people have the idea that only the rich and famous come for plastic surgery and cosmetic surgery, but it's not the case. I would say the majority of my patients are ordinary people who have very, simple concerns, maybe concerned about a little extra fat on their tummy, or the breasts have gone south since they've had kids, and they're just looking to tune up one thing and get themselves ready to go out and wear their bathing suit around the pool.
That's right, and so you are serving the population of Mississauga, Brampton, and Toronto, right? So not celebrities, everyday people.
No, everyday people, and that's by far the majority of patients who come in.
Well, and I love that you mentioned too, they probably want more confidence, so that's probably something that you're instilling in them with your services.
Well, I'd like to think that most of the patients that come in have very realistic expectations. The plastic surgery junkies that come for multiple procedures, really not very common. Most people are just looking to fix one thing about themselves, and it really does make a big difference. It makes them a lot more confident and comfortable with who they are.
Well, one thing I want to touch on is we had Miriam on just earlier. So with Botox and fillers available, like what she discussed, what role does surgery have in things like facial rejuvenation?
Well, Botox and filler are phenomenal tools. They really have a lot of versatility, and they can improve a lot of areas of concern. But it's important to remember that every tool has its limitation. There are certain things that they can accomplish and certain things that are beyond them. And it's important to know when you're reaching the limits of a tool. So Botox and fillers, when you've gone past them and there are certain concerns that you can't address, then it's time to start thinking about surgical options. And those surgical options are exactly what you might think of: facelift, brow lift, surgery around the eyes for eyelid concerns. And people get to that point often a little bit later in life after they've gone through having some fillers and Botox to maintain themselves, and then when they're ready to take the next step, they go on to the surgical options.
And what kind of a downtime are people looking at with those types of options these days? Because I know that they've much improved over the past decade, I guess.
Well, it's a good point, and it's the surgery has improved a lot, but also the anesthetics have improved a lot.
Right.
The types of medication that people get for the anesthesia, they wear off very quickly, very low rates of nausea. So people really recover very quickly after these kinds of operations, which are generally fairly short. Almost all of them are day surgery. Patients go home right after the operation, and recovery times may be anywhere from 3 to 7 days. And after that, most people are ready to get back to ordinary activities.
So that's a lot quicker than I think most people are aware of. I mean, they're in and out on the same day of the surgery almost all the time.
Yeah, absolutely. And it's only the rare patient for longer procedures or where there's more involved that they need to stay overnight, and we'll keep patients overnight when we need to.
Okay.
But the vast majority of the procedures we undertake are day procedures.
And now, how would somebody go about selecting a procedure? Do they meet with you first, or do they have a consultation? How would that work?
So usually we have patients come in and they meet both with my nurse and myself and go through their particular concerns. The first part of a consultation is really about eliciting and bringing out from the patient what they're concerned about. It's very important for me because I don't like to inflict on a patient what my concerns are or what I see.
Yeah.
I want to know what their concerns are and bring that out, and then I try to see how we can address those things. So that's the main point in a consultation, and then we go into the details about the surgery and the recovery time and that kind of thing.
Excellent. And so you alluded to at the beginning of the show, fat loss, I guess, or fat removal and breast enhancement are popular in the summer. So let's talk a little bit about the breast enhancement. What I want to know first is, what is the difference between a breast lift and a breast augmentation?
Sure. So the breast augmentation is meant to address volume concerns. So if a patient is concerned that her breasts are not large enough, or they want them to be enhanced in terms of size, a breast implant is the best option for that. A breast lift is a reshaping procedure, and usually that's something that's undertaken after someone has had children, or perhaps if they're a bit later in life and gravity has taken its toll on breasts. And when they're sagging and change in shape, A breast lift can lift things back up and bring things back where they belong. So both of them are very different, but they can also be done together. So some patients who have lost volume and their breasts are a bit smaller after having kids, for instance, they also need an implant to give themselves some volume, and then the reshaping as well on top of that.
So it sounds like quite a few options to address whatever the patient's goals are.
Exactly, and it's tailored to the patient, the type of procedure that they have, and if they have a breast implant put in, there are hundreds of different types of and sizes of breast implant to choose the exact one for the patient.
And let's talk about that. We've got a couple of demos here. Can you tell us a bit about what we've got on the table here?
Sure, absolutely. So I brought in a selection of breast implants. These are all the silicone gel implants.
Silicone gel, okay.
So the two main options for implants are saline and silicone. I would say 95% of my patients, I use silicone implants. That's pretty much at this point the standard in North America.
Why? What's the difference there, can I ask?
Well, the difference is the content. So all implants have a shell. The outer shell is made of silicone. But the filling is the difference. So the filling here is silicone gel. In a saline implant, the shell would be almost identical to this, but what's inside is saline. And so there was a period of time that we considered that to be a safer alternative. And at this point, it's not really the case. We recognize that both are very safe alternatives. And in fact, in Europe, it was never even considered. Saline implants don't exist in Europe. They never did. And the European surgeons have never handled a saline breast implant before.
Really?
They think we're weird that we still use them sometimes. So the silicone, in most patients, it's a better option, and the main reason is that saline implants have a lot of rippling. So implants tend to form some folds around the edges. Saline implants form a lot of them, and it's often visible through the skin, especially in thin patients or patients who don't have a lot of breast tissue. So for that reason, they're often not the best choice for many patients. Someone who's a bit bigger and a bit fuller, put a saline implant in, and it's a perfect alternative. But for most patients, I usually steer them towards the silicone implants.
So it's more realistic look then we're talking with.
Yeah, a more realistic look. Oftentimes if you look in those celebrity magazines, the thing that you can see immediately that shows whether someone's had a breast augment is the folds and the ripples that form on their breasts. So have a look next time you look at the Hello magazine.
I'll keep that in mind. So the other topic too that we touched on was fat removal. Can you tell us a bit about the different options that patients have when they want to address unwanted body fat?
Sure. The two main options are surgical and non-surgical. So the surgical side is what you might think of. It's liposuction is a common way of removing extra fat. And then there are other specific body contouring procedures. So for instance, to address the tummy area, a tummy tuck is the most common thing that we do. Liposuction versus tummy tuck, a lot of people ask about that. And the main difference there is liposuction is a fat removal technique. If you think of any body part being like a beach ball, you can deflate that ball and make it smaller, but in the end, the surface is still going to be excess and wrinkled. And that's often the case of people who come to me and ask for liposuction of the tummy. Really what they need is a tummy tuck. And that removes extra fat and extra skin and helps to slim and reshape. The other alternative for body contouring, that's the non-surgical side, there are a few different machines available that can reduce fat without any surgery and with no incisions at all. And one of those options is something called liposonics.
I think we have a picture of that.
Yeah, I think that we do.
Too.
So the liposonics unit is based on ultrasound energy. So ultrasound, the same as we use to image babies' heads and things like that.
Yeah.
It's more intense, and this degree of ultrasound energy gets transferred into the fat, heats it up, and makes the fat cells pop, and then your body absorbs the fat and digests it, and you lose fat. You can take off 1 inch with 1 hour treatment.
Wow, and so I guess that's an option that people, if they're worried about this surgery, they can go with that option instead.
Exactly. A lot of people don't want to have the surgery. They're not interested in any downtime at all, and they don't like the risk that's associated with surgery, so they prefer a non-surgical alternative, and we have a few good options for them.
Well, I love that, and I love that you addressed the liposuction too, because I was always concerned what about the extra skin. So with the tummy tuck, that would be addressed.
Exactly, and liposuction is still a great option, and that's one of the main reasons that we have to consult with patients and choose who's the best candidate for a particular procedure. For someone who doesn't have a lot of extra skin and they have just a bit of extra fat in an isolated area and they have good skin tone, their skin is nice and elastic, liposuction is a great option for them. But someone who has a lot of extra skin, whether it's on the tummy, the thighs, the arms, anywhere. Liposuction is not good for those kinds of people.
Right, which is why the consultation is key.
Exactly.
So tell us too about the technology that you're using for patients to help visualize what their results will look like.
So the technology that I like to use is a system called the Vectra, and that's a phenomenal new technique that I have. The system is a very high resolution system that can capture a three-dimensional image of a patient, face, breasts, body, and takes that image, and I can actually simulate certain operations for patients and show them what they could look like after surgery. One of the great things that it can do, for instance, is for breast augmentation. It can portray very accurately specific breast implants. So I can show a patient what one volume or one size of implant would look like compared to another in their body, and they get to see what it's going to look like. They get to try on an implant before they have any surgery at all.
That's great. That's something we definitely didn't have years ago.
Oh yeah, years ago what we used to do is we'd tell patients to go home and take Ziploc bags and fill it up with water or dry rice and stuff it in their bra, which usually ended up being just a messy thing to do and not very accurate. So this is a much better step forward.
Excellent. And one last thing I want to touch on before we head out. You are part of the opening of a brand new Sanctuary International Spa in Muskoka. So perhaps tell us a bit about that.
Sure, I'm very excited about that. We are going to be opening up a Sanctuary Day Spa at the Windermere House Resort in Muskoka. So that's located on Lake Rosso. And we're partnering with Oliver and Bonaccini at the Windermere Resort. They're providing all the food services there. The spa is going to provide all the typical relaxation services that a resort spa would have. And in addition to that, we're going to be offering medical services, including injectables like Botox and fillers, and the liposonics. So we have a great offering up there, and we're very excited about opening that up.
Great. And so perhaps in the last 30 seconds, any things that you recommend to patients at home that they can start doing to feel or look more healthy? Anything?
You know what, I think feeling and looking healthy starts internally. You have to look at your lifestyle, exercise and eating well, having a healthy diet. Those are the first things that anybody should do, and quitting smoking if they smoke. Excellent.
Well, thanks so much for coming on the show, Dr. Goldberg. If you have any questions, you can always refer to his website and his phone number. So today, that's the end of tonight's show. Basically, we took a look at how we can achieve our ideal summer body. So we spoke to a personal trainer, a yoga instructor, Dr. Goldberg on plastic surgery options, and then Miriam. That's it for tonight. We'll see you back next week.